Epidurals are very safe. It's actually a technology that we've used since the 1800s. It's just that in current times, our medicines are better, our equipment is better, and it's safer for the patient with less complications. When I'm inserting the epidural, I will touch your hips on both sides, and I'll feel your spine. And when I insert my needle, there's no chance of any kind of spinal cord injury or damage, because your spinal cord actually ends about 2/3 of the way down your back, and I'm going to be way, way lower toward your pelvis area. You will have some minor discomfort, similar to maybe the IV start. It will be a little bit different because I'm going to put some numbing medicine around the skin, which is usually where the most discomfort is felt. So after the numbing medicine, it feels like a little bee sting. After I put the numbing medicine in, you should be nice and comfortable. After the catheter's in and the medicine is injected, it takes about 10 to 20 minutes for the medicine to start working, mostly because the medicine is put in your epidural space and it needs to diffuse into where the spinal fluid is, where the nerves are. So it takes a little bit of time for that diffusion to happen. Unfortunately, you can't walk around because your legs will be numb and it wouldn't be safe for you to be up on your feet. You'll be in bed after the epidural is inserted. Eating and drinking, you can have some clear liquids, and the reason we want to limit you to clear liquids is because if we need to go to C-section to get your baby, we want you not to have the risk of aspiration. The timing is not terribly critical. Early on is fine. Very late in the labor process is sometimes a problem, because if you're really close to delivery, the epidural has a hard time catching up to your pain. The epidural, once inserted, is great because you can use it for the duration of your labor, but if we need to go to C-section, we can add extra medicine to the epidural to get you numb for the surgery. There's always a risk that the epidural may not work. It's not an exact science, and it's frustrating for you and it's frustrating for us when it isn't perfect. Because the catheter's there, we can add medicine, we can change your position. Gravity still works in your body, so if you're feeling more on one side versus the other, we can tip you a little bit, and then the medicine will flow that way and try to cover those nerves. So after you get the epidural, your legs will be numb and weak, and so you won't be able to get up to the bathroom, so your nurse will insert a catheter in your bladder to drain the urine. If you have high blood pressure before pregnancy or develop high blood pressure during the pregnancy, an epidural will lower your blood pressure usually to a normal range. We will take your blood pressure every 3 to 5 minutes to make sure that your blood pressure stays within your normal range. And if we need to support your blood pressure after the initial dosing of your epidural, we'll do that with some IV medications. After the epidural is placed, anything that you perceive to be abnormal, you should inform your nurse. One of the things that we commonly see is patients feeling nausea, and that could be a sign that your blood pressure is lower than what is normal for you, and we will help treat that with medicine in your IV.